Hi everyone, my name's Dr. Liz O'Riordan and I'm a breast surgeon who got breast cancer, which is quite ironic really. I realised when I was diagnosed that I knew nothing about what having breast cancer was like. I'd got degrees, I got piles of papers, I was really good at treating patients with the latest evidence, but I never had the treatments. When I was diagnosed, I bought 20 books written by patients because I wanted to know what it was like to decide whether to have a reconstruction or what was tamoxifen like. It's one of the reasons I wrote my book, The Complete Guide to Breast Cancer, with all the questions that I wished I'd had the answers to. You know, a lot of people ask me what was my own breast cancer story, so I thought what I'd do is a little video about it today, telling you what happened to me, just in case you're nosy, because I know I would be. So, I was 40. I'd had a couple of cysts in my breasts, they were very lumpy, and I'd had a mammogram and an ultrasound 6 months before I found the latest lump. It was in June 2015, and I swear one morning I just looked down after the shower and there was a lump in my left cleavage. I swear it hadn't been there the day before. And I just thought it's another cyst. It was smallish, it was round, I wasn't worried, and it was only my mum who made me go and get it checked out. My mammogram was normal. I do have quite dense breasts, so my surgeon did an ultrasound, and when I turned to look at the screen, I knew it was a cancer. Because I do ultrasounds myself, I knew it looked like a classic cancer. And I could see that it was big. It looked to be about 2 or 3 centimetres in size, and because I was young, I was 40, I knew that I would need chemotherapy. I had a good idea what my risk of being alive in 10 years was, because this is my job to know these things off the back of my hand. I knew I needed a mastectomy because the cancer was large compared to the size of my breasts. Because it wasn't seen on the mammogram, I had an MRI, which is often done with people when you have dense breasts. And the MRI showed that it was actually 5.5 centimetres in size. That's a big cancer. And I'm a consultant breast surgeon. I'm meant to have expert hands, and I hadn't felt it. The biopsy showed it was a mixture of ductal cancer and lobular cancer, which doesn't happen very often. The ductal cancers tend to form in lumps and form a mass that you can feel, whereas lobular cancers tend to grow in sheets. It was ER positive and HER2 negative on the biopsy. And based on all of that, my team decided to give me chemotherapy first. When you're young and you've got a large cancer, you're going to be given chemotherapy anyway to reduce the risk of recurrence, even though my lymph nodes were negative on the ultrasound scan. And one of the upsides of giving it first is that it can sometimes shrink a cancer down completely, which means you can avoid a mastectomy. So within a couple of weeks of being diagnosed, I was having chemotherapy, and I had 3 rounds of docetaxel and then 3 rounds of FEC, and the chemo worked. Every scan I had during treatment showed that my cancer was melting away until the final MRI before my surgery. There was almost nothing to see in the breast. I couldn't believe it. I still decided to have a mastectomy and implant reconstruction because my breasts are small, and I just wanted that safety of knowing the breast tissue had gone. And it was really hard because my surgeon was a friend. She trained me how to do breast reconstructions, and there was I telling her, can you put the scar here and use these stitches? And she had to say, stop it, just be a patient. That was in December. And I went to get the results. I remember it now. It was the 23rd of December, 2015, just before Christmas. And I walked into that room smiling and happy because I knew my nodes were negative and the chemo had melted the tumour away. But it had only melted the ductal cancer away because there was still 13 centimetres of lobular cancer left in my breast, and my lymph nodes were positive. And I knew what that meant. I knew that I had a lower chance of being alive in 10 years because my lymph nodes were now involved and my cancer hadn't responded to chemotherapy, although lobular cancer rarely does. It meant that I'd need more surgery to remove the lymph nodes underneath my arm, and I'd need radiotherapy to the chest wall. And that was a really, really tough time. One of the problems for me with my arm was I got cording, which is something I knew very little about as a consultant breast surgeon. It's when tiny little lymph channels thrombose and form tight cords, often underneath your arm, and it can run down your implant towards your tummy. And what they do is they stop you being able to lift your arm up. And to have radiotherapy, you have to be able to lift both your arms above your head. And it took me 3 months of physiotherapy to be able to do it. I almost had a frozen shoulder. But I had the radiotherapy and I started on tamoxifen. I also struggled with chronic post-mastectomy pain syndrome, which can happen in 15 to 30% of patients. Now, it's normal to get a numb patch of skin underneath your arm when the nerves have been divided to remove the lymph nodes. And sometimes you can get an electric shock feeling as the nerves start to grow back together. But I had really severe burning pain on my chest wall, so it was too painful to wear a bra. Over the next 6, 7, 8 months, my implant started to change because of the radiotherapy, which can happen. It formed a capsule. Now, a capsule normally forms around an implant, a bit like a pea in a shell, but because of radiotherapy, my capsule started to get really tight and it pulled the implant up and out towards my armpit, and it became really quite painful. And I had the implant swapped out and the capsule scored to see if that would help. But another 6, 7, 8 months later, the radiotherapy had done its thing again, and the implant was really painful and sore, and I was ready to go flat. I couldn't be doing with it anymore. At the same time, I'd been having physiotherapy every couple of weeks on some scar tissue in my armpit because I'd had my sentinel node surgery, then an axillary clearance. And when I went to see my surgeon to talk about going flat, she said, let's just do a scan of this scar tissue here just to make sure. Yeah, fine. It showed a 2.5 centimetre recurrence, and that was less than 3 years after my first operation. And I'm a consultant surgeon, and I didn't realise that's what it was. I just thought it was a hard nodule of scar tissue. And that changed things completely. It meant I had to go flat to get rid of all the cancer tissue on my chest wall. It meant I needed another dose of radiotherapy in the same area that's rarely done. And because my cancer had come back on tamoxifen, it meant I had to go onto an aromatase inhibitor. And it turned out that chemo hadn't completely switched my ovaries off, so I was back on Zoladex injections, which I forgot to say I had in the beginning. Often young women are given Zoladex injections to switch their ovaries off, just to slightly reduce the risk of recurrence a bit more. I stopped them after 6 months because I couldn't handle the side effects, and it was only a small increase in benefit. But now I needed to have them so I could go onto an anastrozole. And after 3 or 4 months of the injections, I said, can I just have my ovaries out instead? I knew I was never going to have children. I was fine with that, and I didn't want 5 years of the injections. So I had my ovaries out. And that was in 2018. And as a consequence of all that surgery, I couldn't move my left arm properly. I still can't get it all the way up. And that meant that I couldn't operate. And I was forced to retire. So the job I spent my life training to do that I loved being a breast surgeon, I had to say goodbye to. And it was really, really hard because I realised I didn't know how to help people anymore. And I didn't recognise myself. I lost my hair during chemo. I'd lost my breast. I didn't know how to dress. The menopausal side effects are really, really hard, and I'll be doing videos about lots of things to help you cope. It was really, really tough. I couldn't flirt anymore. My long hair had gone, and I remember having cleavage envy. Whereas before, as a breast surgeon, I would watch women and say, she's had implants, she hasn't. Now I just look at them and say, I miss having a cleavage. 5 years down the line, I'm not bothered by my body anymore. I don't mind, I don't wear a bra anyway because of the chronic pain, but I don't mind being flat. I don't mind being lopsided. Time has been a great healer for me. But you still get scares every time someone in the news is diagnosed, every time it's my yearly mammogram. I had a colonoscopy last week for rectal bleeding. That fear of it coming back is always there. And I think that's kind of why I do what I do on here. I want to help educate people so they understand what breast cancer is like, both the general public, patients and doctors. And I think with education and knowledge, we can all have a much better quality of life and understand what's happening to us. So that's my story in a nutshell. If you've got any other questions, let me know, and thanks for subscribing to my channel.